I was working the night shift at a pharmacy in Amsterdam when an American tourist walked in holding his stomach. He asked how much an emergency room visit would cost. I told him around 400 euros with his travel insurance covering most of it. He laughed and said that was impossible because his appendix removal in Boston cost $43,000. So a simple stomach check in Europe must be at least $10,000. I explained our healthcare system is different. He insisted I was scamming him with fake low prices to lure him in, then hit him with the real bill later. He said he knew how hospitals worked and pulled up his Boston hospital bill on his phone as proof that I was lying. I told him I wasn't a hospital, just a pharmacy, and recommended he go to the ER. He asked if I was trying to bankrupt him. I suggested an over-the-counter medicine for 8 euros. He said 8 euros was suspiciously cheap and asked what the catch was. There was no catch. He bought nothing and left, saying he'd rather fly back to Boston than fall for European healthcare scams. He had food poisoning. You're already seeing the pattern. This isn't about healthcare, it's about mindset. I study these cross-cultural collisions full-time, so you don't have to. If decoding global behavior like this clicks with you, you're exactly where you should be. Stay. My cousin works at a Dublin hospital. An American woman arrived with a broken finger and immediately asked for the payment desk. She wanted to negotiate the bill before treatment. The receptionist explained she needed to see a doctor first, and they'd discuss payment after. The woman insisted that was backwards because in America, you always know the cost first. She demanded an itemized price list for finger x-rays, doctor consultations, splints, and painkillers. The receptionist explained Ireland doesn't itemize before treatment. The woman accused the hospital of running an illegal business. She asked how anyone could consent to treatment without knowing the cost. She threatened to report them to the American Medical Association. The receptionist explained the AMA had no jurisdiction in Ireland. The woman sat in the waiting room for 2 hours researching Irish healthcare law on her phone, convinced she was about to uncover a massive fraud scheme. She got treated, paid 100 euros, and complained the price was suspiciously low for a broken bone. And that was just Monday. I work at a small clinic in Copenhagen. An American man arrived for a basic checkup his hotel recommended. First thing he asked was if we were in network with Blue Cross Blue Shield. I explained we don't use the American insurance network system. He asked how I could legally operate a medical facility without being in network with someone. I told him we work with travel insurance and direct payment. He said that sounded like a black market operation. He wanted to see our network participation contracts. I showed him our Danish medical license. He asked if it was internationally recognized or just a local thing. I said it was valid in Denmark, which is where we were. He asked how patients knew we were legitimate without insurance company verification. He pulled out his insurance card and read the fine print about out-of-network penalties. He calculated he'd pay 80% out-of-pocket versus 20% in-network. He asked if we could pretend to be in-network for billing purposes. I explained that wasn't possible because we weren't in America. He suggested we could code the visit as something else that his insurance would cover. When I refused, he asked to speak to our insurance liaison officer. We didn't have one. He asked how we submitted claims then. I explained again that we don't submit to American insurance. He accused me of discriminating against American insurance holders. He spent 30 minutes on the phone with Blue Cross trying to add our clinic to their network. The insurance representative apparently explained that's not how international healthcare works. He asked if we accepted care credit instead. I had no idea what that was. He showed me a medical credit card and asked why we didn't accept it when every legitimate American medical facility did. I told him we accepted regular credit cards, cash, and bank transfers. He said that sounded extremely unprofessional for a medical establishment. The checkup cost 200 kroner, about $30. He kept asking what the hidden fees were. There weren't any. He left a negative Google review saying we operated without proper insurance verification protocols. A flight attendant friend told me about an American passenger who had a Panic attack mid-flight from New York to Stockholm. When they landed, paramedics came aboard. The passenger refused treatment and kept asking how much the ambulance would cost. The paramedics said it was free. He didn't believe them. He said American ambulances cost $3,000 minimum, so Swedish ones must cost at least $5,000. He demanded they tell him the real price. They insisted it was free. He accused them of lying to get him into the ambulance, then surprise billing him later. The paramedics explained Swedish emergency services don't bill patients. He said that was economically impossible and asked who paid for it. They said taxes. He calculated that Swedes must pay 90% income tax to afford free ambulances. The paramedics left. He took an Uber to the hospital instead, paid 400 kroner, and bragged about outsmarting the socialist healthcare trap. I work reception at a medical center in Oslo. An American woman called asking if we accepted her HSA card. I didn't know what that meant. She explained it stood for Health Savings Account. I told her we accepted debit and credit cards. She said no, this was specifically a health spending card that could only be used for medical expenses. I said that sounded like a regular debit card with extra steps. She got frustrated and said I clearly didn't understand American healthcare finance. She asked if we were HSA-eligible providers. I said we were a Norwegian medical center, so probably not. She asked how Norwegians saved for medical expenses without HSAs. I said most people didn't need to save because healthcare costs were lower. She said that was propaganda and asked for our real prices. I gave her our standard consultation fee of 300 kroner. She did a currency conversion and got angry that it was only $28. She insisted I made an error because her American doctor charged $250 for basic consultations. She said our prices were unsustainably low and we'd go bankrupt within a year. That was 5 years ago. We're still operating. I'm a pharmacist in Berlin. An American tourist handed me a prescription from his Florida doctor for 90-day supplies of 3 medications. I explained German pharmacies typically dispense 30-day supplies. He said he needed 90 days because that's what his insurance covered. I told him German regulations limited initial prescriptions. He insisted his American insurance overruled German pharmacy law because insurance companies have more authority than governments. I stared at him. He asked if I understood how insurance worked. I explained I understood how German pharmacies worked since I worked at one. He asked to speak to my manager about getting an insurance override. I was the manager. He called his insurance company on speakerphone. The representative confirmed they didn't have authority over German pharmaceutical regulations. He asked why they sold him international coverage if it didn't work internationally. The representative explained it covered costs, not regulations. He demanded a refund on his insurance premium. I gave him a 30-day supply. He asked why European healthcare was so inefficient compared to America's streamlined system. I had no response to that. My colleague in Prague told me an American customer tried to use a GoodRx coupon at her pharmacy. She'd never heard of GoodRx. He showed her the app and explained it was a discount program that lowered prescription costs. She said Czech pharmacies didn't participate in American discount programs. He insisted they must because GoodRx worked at over 70,000 pharmacies nationwide. She pointed out they weren't in America. He said GoodRx was international and showed her the app's terms of service. It said, participating U.S. pharmacies only. He argued that was discriminatory. He asked why Czech pharmacies refused to help Americans save money. She explained Czech medication was already cheaper than American prices, even without coupons. He didn't believe her and pulled up Rx list to compare. His American prescription cost $340 with insurance. The same medication in Prague cost 200 koruna without insurance, about $9. He accused the pharmacy of selling counterfeit medication because real medicine couldn't be that cheap. I work at an Italian pharmacy in Rome. An American woman asked if we price-matched American pharmacies. I asked what she meant. She explained that some U.S. pharmacies match competitors' prices, so she wanted us to match her CVS receipt. I told her that wasn't how international pharmacies worked. She showed me a receipt for amoxicillin that cost $85 in Miami. Our price was 12 euros. She insisted we honor the lower price. I explained our price was already lower. She did the currency conversion wrong and thought 12 euros meant $12, which would be cheaper than 85. I corrected her math. She got angry and said European pharmacies were taking advantage of tourists by charging in euros instead of dollars. She demanded we convert our prices to dollars for American customers. She asked why we didn't accept manufacturer coupons like American pharmacies. I explained European medication pricing worked differently. She pulled out a folder of pharmaceutical coupons from various American drug companies. None were valid in Italy. She asked to speak to the pharmaceutical sales representative to get Italian coupons. I explained manufacturers didn't visit pharmacies with coupon books here. She asked how Italians afforded medication without coupons. I said medication was cheaper. She said that didn't make sense economically and asked what the real system was. There was no hidden system. That's the real tension I track. When an entire worldview meets reality and can't compute it. If you caught that, you already think like the people who subscribe here. Most people scroll. A few study the pattern. She left to find a pharmacy that understood American healthcare customers. A friend who works at a London pharmacy told me an American man insisted his doctor's prescription was valid in the UK because both countries spoke English. The pharmacist explained UK doctors needed to write UK prescriptions. He said his doctor went to medical school, which should be internationally recognized. The pharmacist agreed his doctor was legitimate, but the prescription format wasn't valid for UK pharmacies. He asked what the difference was since both countries used the same language and measurement system. The pharmacist explained the UK used metric measurements, not imperial. He insisted pounds and ounces were universal. The pharmacist showed him a medication bottle measured in milliliters. He said that proved the pharmacy wasn't properly regulated. He demanded they convert his prescription from freedom units to metric. The pharmacist said he needed to see a UK doctor. He asked why the UK made healthcare so complicated when America had it figured out. I work billing at a hospital in Lisbon. An American patient received treatment for a sprained ankle and got a bill for 70 euros. He came back the next day insisting we forgot to add the charges. I told him that was the complete bill. He said impossible, because an ER visit in Texas cost him $4,200 for the same injury. He itemized everything we must have forgotten: facility fees, doctor consultation fees, X-ray technical fees, X-ray interpretation fees, nursing fees, equipment usage fees, and medical waste disposal fees. I explained all of that was included in the 70 euros. He accused us of committing billing fraud. He said itemization was legally required. I showed him Portuguese billing regulations. He couldn't read Portuguese and insisted I was showing him fake documents. He demanded an itemized bill in English with CPT codes. I explained we didn't use CPT codes. He said all legitimate hospitals used current procedural terminology codes for billing. I told him that was an American system. He asked what system we used instead. I said we just charged for the treatment. He asked how insurance companies knew what to reimburse without codes. I explained most patients didn't go through insurance for bills this small. He calculated that Portuguese people must go bankrupt from medical bills if they paid out of pocket. I told him 70 euros wasn't bankrupting anyone. He said it would be thousands with proper itemization, and we were clearly undertaxing. He filed a complaint with hospital administration demanding a real bill. The administrator sent him the same bill with a note explaining Portuguese healthcare costs. He replied asking who to contact about American billing standard violations. Nobody, because we weren't in America. My sister works at a Stockholm dental clinic. An American patient needed a filling. She asked for a treatment plan with cost estimates before proceeding. The dentist provided one, 800 kroner. She said dentists in Oregon required multiple consultations before treatment plans. The dentist explained he'd just examined her teeth and could do the filling now. She insisted she needed time to get second opinions and compare prices. The dentist said she was welcome to do that. She asked for recommendations for other dentists. He gave her 3 names. She seemed confused that he'd recommend competitors. She asked if they paid him referral fees. They didn't. She asked why he'd send patients away then. He said patient choice was normal. She said American dentists never recommended competitors because it was bad business. She got the filling done, paid 800 kroner, about $75, and posted on Facebook that Swedish dentists didn't understand capitalism because they recommended competitors and charged suspiciously low prices. I'm a doctor in Vienna. An American patient came for a consultation and asked how much it would cost to keep his prescriptions exactly the same as his American ones. I said I'd need to review his medications first. He handed me a list of 7 prescriptions with specific brand names and dosages. I explained some weren't available in Austria, and I'd prescribe equivalent medications. He refused. He said he'd been taking these exact brands for 3 years and couldn't change. I explained the active ingredients would be identical. He said brands mattered because American pharmaceutical companies had better quality control than European ones. I told him many American medications were manufactured in Europe anyway. He didn't believe me. He asked if I could write prescriptions for the American brands, and he'd have them shipped. I said that defeated the purpose of seeing a local doctor. He agreed to try European equivalents, but made me write down that he was doing this under protest in his medical file. I refused to write that. He asked if I was refusing to document patient concerns. I documented his preference for American brands, which was different. He asked for copies of all pharmaceutical safety reports for the European medications. I told him to look them up online. He said that was unprofessional, and American doctors provided that information automatically. I told him American doctors definitely didn't do that. He insisted his doctor did. I asked if he meant the pharmacy printout stapled to the prescription bag. He said yes. I told him pharmacies here did that too. He left satisfied but later emailed asking if Austrian pharmaceutical safety standards were equivalent to FDA approval. They were different systems. He asked which was better. I didn't answer that. Somewhere right now, an American is explaining to a confused Norwegian doctor that healthcare can't possibly work without prior authorizations, and wondering why the doctor looks so baffled. I don't chase outrage, I map behavior. Every week, I decode how culture programs us without us noticing. Subscribing doesn't help me. It helps you catch the next contradiction before you live it.